Hello. Hope y'all are doing well. Today we are here to talk about some information, ask some questions, and most importantly, discuss endometriosis. Now, can we hope for a future with less painful periods? Whether that be for ourselves or the women in our lives that are plagued with pain, I imagine we all want better pain management. Now, my name is Sarah, and together with Gavin, Reese, and Dev, we will be discussing the possibility for the future in the treatment of endometriosis. And what is endometriosis? Endometriosis is a disease where the inner lining of the uterus grows in areas outside of the uterus, as depicted here. This inner lining is called the endometrium, and it's a layer that sheds during a woman's menstrual cycle or period. And this process can typically cause discomfort for any women, but with endometriosis, the pain can be miserable. These women experience more pain due to the tissue that doesn't belong, and a type called deep infiltrative endometriosis can be particularly hard to treat. Endometriosis can feel like severe pain or cramping during a period, long-standing pain in the lower abdomen, lower back, and pelvic regions, or a painful time during intimacy. Unfortunately, there is no cure, but it can be treated, and about 50 to 80% of women find relief through treatment alone. But that also means that while some women find relief from treatment, for example, through standard hormone therapy like birth control pills, about 20% or more still have pain afterwards. And now, how can we help that 20% that still have leftover pain or residual pain after treatment? What are our next steps? So the body has a lot of electrical wiring, like an old house that's been fitted for the newest tech multiple times over. Now, in your body, that wiring sends an electrical pulse to your brain, telling you about what your body's feeling, how you're feeling it, and where you're feeling it. And that's all very important information, but sometimes it hurts. Think about a time when you've had a cramp in your leg, for example, or lower stomach, to be very on topic for today, but wherever it is, your body sent a pulse to let you know what was happening. And electrotherapy uses that idea to also send pulses, but it uses an electronic external device to apply those pulses to an area that might be causing you pain. Um, like this one down here, for example. This one is it is self-applied, but it is a subcutaneous electrical nerve stimulation. That's really hard for me to say, so if I have to say it again, I'll probably call it TENS. Regardless, the idea is to potentially use that to improve the quality of life for women who experience that hard to treat pain that's not going away with the regular standard therapy. Um, and hopefully this helps. And what we will be discussing more here is what these scientists here studied. And they do claim that adding electrotherapy to treat women with endometriosis could improve their pain better than their standard hormone treatment alone.
Alright, now to the methods portion. So, why are methods important? Well, they give us clear steps to follow, and they give us more reliable results. So what are the methods used here? Well, to start, I would like to define a few terms that I think are important to this trial. So to start, we have the experimental group and the control group. Now, the experimental group is the group that is going to be receiving the treatment. and the control group is the group that is not receiving any treatment. And here we have 53 people in the experimental group and 48 people in the control group. So, why is this important? Well, we need something to compare. So, say we have two plants and we want to test a new type of fertilizer to see if we can make plants grow faster. What we can do is give the plants the same amount of water and sunlight, but only give one plant the fertilizer. And if the plant with the fertilizer grows taller, then we know it's because of the fertilizer. That is the same thing we're doing here. We want to compare the group getting a treatment to a group not getting a treatment to see if it works. Now next, we have electrotherapy. And this is a way of using electrical energy to attempt to treat a variety of medical issues. This is what the scientists were using in this study. Now we also have hormones, and these are pretty much like tiny messengers in your body. They travel through your blood and tell different parts of your body what to do, like when to grow, how to use energy, and even tell you when to feel happy or sad. And finally, we have endometriosis. Now, you should already have a bit of an understanding of this from the introduction to this, but it's, just to recap, basically when tissue, like from the inside of the uterus, grows in wrong places. Now, in this study specifically, it is tissue that's growing on organs that should not be there. All right, now, who did they test? Remember how before I mentioned that the methods can give us more reliable results. This is how, by being able to control who to include in the test, we'll be able to give us tests that are more safe and reliable. So for this study, they included women with endometriosis. They included women that already were using a hormonal treatment and women who had experienced pelvic pain. And in the same way, they excluded women who had heart conditions, who were pregnant, had allergies, or had any other uncommon conditions. Now, the main reason scientists do this is because these extra things could change the outcome of the study. Remember the plant example I used earlier. If one of the plants had a condition that the other one doesn't, it may not give you a definite answer to whether or not the fertilizer works, because that condition may also be affecting the growth of the plant. Again, the same thing is happening here. By including women with very similar conditions, we can be more sure that the results we get are the right ones. Alright, now finally, what are they testing? Well, this study was done over a series of 8-week periods. Now, this means that they would treat the women for 8 weeks, have them come in for a checkup, and then continue for another 8 weeks. Again, back in the plant example, we were testing the amount of growth that happens because of the fertilizer. For this study, however, they are testing the amount of pain women are still in during these intervals. This is the main thing they were trying to test from the electric therapy. They use a scale called the visual analog scale and ask women to rank their pain from 1 to 10. Now, if the therapy was successful, then the pain should go down. If not, it should stay the same. Now, there's one more thing they're testing from this, and it's the quality of life. This is basically a person's overall well-being. For this, they use two different tests. They're basically two surveys that the women would take before and after the treatment period to see if things in their daily lives get better or stay the same. We'll go into depth with this later, but these are the main methods used for this study.
Okay, now let's go ahead and get into some of the results from this experiment. We know that when examining the electrotherapy effectiveness on endometriosis, we focused on three main groups, which was pelvic pain overall, quality of life, and then female sexual function. And great news is that we did find out that electrotherapy is beneficial to help out with pain that might come from endometriosis and overall just better the quality of life in women that struggle with this function. Okay, now getting into some of the nitty gritty stuff, we're first going to start with the pelvic pain category, and this is just some of the data that we found from the experiment. So, first off, to the right, you're going to see a figure, and it's basically just a graph that's showing the results from the experiment for the VAS, or the visual analog scale. Now, VAS and DDS, as you can see in the left column, they're just measurement tools, ways that the pelvic pain was measured in this experiment. So it's important to note that the VAS runs on a 0 to 10 point scale, 0 without any pain, and then 10 is intense pain. And then when we talk about the DDS scale, it's 0 to 3, so 0 without pain and then 3 to intense pain. And when we look at the data from this experiment, we see that chronic pelvic pain for VAS reduced by 3 points, which is pretty significant. And then same thing with the reduction with dyschezia, it was by 4.5 points. We did note that pain during spotting showed no change, and neither did dysuria. And then for DDS, there was an insignificant reduction. So it wasn't that there was no change in pain after the electrotherapy treatment. It was just that it wasn't really as large of a change as the chronic pelvic pain and the dyschezia was. So we know the effectiveness now of electrotherapy on pelvic pain, but let's talk about the other two categories. So we looked at the quality of life, and of the 101 women that were used to conduct this study, all of them showed an increase in all of the domains for quality of life, which is really promising for electrotherapy on women's mental health and just overall life. So we can see that there's, in the left-hand column, the pain domain, the control and powerless domain, the emotion domain, the social and support domain, the self-image domain, and the work domain all showed significant improvements after electrotherapy. And when we talk about the female sexual function, this is another category that we examine to find the effectiveness of electrotherapy. And it showed that it modestly improves female sexual function. We noted that desire and lubrication, pain and arousal all showed minimal increases, or pain showed a decrease, but then arousal, desire, and lubrication showed increases. There was no improvement with orgasm frequency, though, after post-treatment. That was the same median for pre-treatment and post-treatment. Okay, so let's go ahead and talk about what these results mean. So the results of the study focused on the comparison of the electrotherapy experimental group, which is the group of women that received the therapy, and then we also talked about the control group, which was the group of women that did not receive the electrotherapy, because we wanted to compare the two to see how effective electrotherapy is on women with endometriosis. So there were a lot of notable differences, primarily in terms of pain reduction, quality of life, and female sexual function. When picking women for these control and experimental groups, we made sure that they had a lot of similarities in their characteristics, like similar age, body mass index, the duration between the onset of symptoms and the diagnosis. We wanted to make sure that these variables didn't influence the outcomes of the treatment. So when we find out what works and what might need more research, we noticed that the reduction of pelvic pain was seen to be significant after the treatment with electrotherapy, specifically the chronic pelvic pain and dyschezia. We noticed that quality of life improved for every woman that participated in this study in all domains, which is a big deal, meaning that electrotherapy can severely improve the quality of life in women with endometriosis and bring back many things that they might have been struggling with before treatment. Female sexual function, there wasn't as much of an increase as we saw with quality of life per se. We did have a modest increase in lubrication and desire and arousal, and overall, with the reduction of chronic pelvic pain, kind of in turn, female sexual function will be better when pain related to sexual intercourse is lower, and that is one thing that we got from our study. The things that might need more research was the pain during spotting and the dysuria, which in these two things, these two pelvic pains not showing much of a change after therapy could suggest that electrotherapy might be less effective for these particular symptoms. It may also indicate that a longer treatment duration or alternative therapeutic approaches might be necessary to achieve noticeable improvements. And this kind of highlights the importance of tailoring treatments to specific symptoms that a patient might have. Everyone is different. Sexual function was one of the ways that scientists measured effectiveness in this study, and we did see that there was a slight increase, but orgasm frequency was one of the things that there was no improvement in, which might suggest that more studies need to be conducted with this in terms of orgasm frequency. In the experiment, they also talk about how a lot of these women were diagnosed at different places. So that could be a variable in this experiment that might need to be conducted or looked into more, because when we take data from these women that were diagnosed by healthcare providers, we're saying, okay, these healthcare providers properly diagnosed them, and we don't know that for sure. So that is a variable in our experiment that could alter the data. We just want to be transparent, as transparent as possible, to kind of show that, to show as much transparency as possible, to be honest.
Hi y'all, it's Dev. I'm going to be talking about the conclusion with y'all a little bit. So, in general, we had two groups in this study. Hi y'all, it's Dev. I'm going to be talking about the conclusion with y'all a little bit. So, in general, we had two groups in this study. We had women without the electrotherapy, but they still had their hormonal treatment, versus the women that had their hormonal treatment and electrotherapy. So, the second group is what I'm talking about. That electrotherapy and hormonal treatment may be effective for chronic pelvic pain, which is one of the big symptoms that we were talking about with endometriosis. And this is like a very prominent, very painful, and also disruptive symptom as well. So that is very promising that we were able to find significant improvement with the treatment of electrotherapy. Also, to a lesser extent, defecation difficulty and pain. Some of that was alleviated, so that was also promising. But it was not as effective for pain during sex or pain or difficulty during urination. So why did we do this study? What is the purpose of this? Well, the purpose is to improve the mental and physical health for women in your community, in all communities. Women should be able to do what they want to do, what they need to do with full capacity, without having consistent pain that might put them out of work, that might not let them, take care of the kids. Like, these are very, very real problems that, again, like I said earlier, are disruptive. And then potentially having this treatment could prevent future health problems that may be associated with endometriosis. Perhaps there's health complications. And the last thing is it could potentially be cost effective, especially if it becomes more common. So those are some considerations, and that is the reason why this study was conducted. So continuing on, I'm going to be talking about future experiments. So the best thing that we can do is to have the same study, but make it better. Have it with more people, long term, so it could be over the course of a year or several years, to see whether that treatment is still effective. Or there's also other therapies that we could do more research on. There's different hormonal therapies, physical and psychological therapies. So I just put an example up. Pelvic floor therapy, it's when you work with a physical therapist and they do a lot of strength and kind of conditioning of those muscles, and it helps you stretch the pelvic floor muscles, and that may alleviate a lot of that chronic pelvic pain. But there needs to be more research on that as well. New drugs, new pharmaceutical drugs could be developed to help treat some of these symptoms as well. So that's another promising field. And the end goal is to cure endometriosis, especially because it is not curable now. Other treatments also can include surgery, but that is not always effective for people. But yeah, we want to cure it, not just treat its symptoms. But for right now, we are just going to focus on treating its symptoms. So thank y'all so much.